I'm now happy to introduce our next speaker, Dr. Erik Puffenberger. Dr. Puffenberger has been the lab director at the clinic since 1998. It is safe to say that he knows more about the genetics of the plain populations than probably anybody else in the world, and has been the driver of the innovation in our lab to provide services that are providing benefit to the community in a way that is fast and effective. So, Dr. Puffenberger?
Thank you, Adam. Good morning, everyone. As Adam said, I'm one of the longest-serving employees at the clinic. I joined the clinic in January of 1998. I was trained as a human geneticist, and I came to work with Dr. Morton back then in the hope that I could bring my expertise to the clinic and build an interesting and exciting laboratory testing program. It has been a great journey. I think that makes, if you do the math in your head, I think that's 27 years that I've been at the clinic. Okay. Can you hear better now? Okay. Yes, so I've been at the clinic for about 27 years. And over those years, I've enjoyed developing a carrier testing program for both the Amish and Mennonite communities. That work, about 10 years ago, took a different turn because a new technology became available called next-generation sequencing, and we brought that technique into the laboratory and developed a test called the Plain Insight Panel. This is a carrier testing platform that we can take a sample from an individual and we can test them for all of the known disease variants that are found in the Amish and Mennonite populations. We do it all in one test. This test covers about 950 different genetic disorders and roughly 1,400 different genetic changes that cause disease. On average, everyone in this room probably carries about 5 variants that cause disease. Generally, that's not a problem unless your spouse carries the same ones. So that's what the expanded carrier screening is all about. It's trying to find couples that are at risk for having a child with a genetic disease. So far, the Plain Insight Panel has tested over 7,500 people. Show of hands, how many people have had a Plain Insight Panel? I know there must be a few of you in here. Very good, thank you. So a lot of people are wondering, okay, why bring the lab guy here today to talk? Right? Usually we just have the physicians, but I want to talk about the Plain Insight Panel because I've had some comments recently, both from the board and from others, about why people would want to do the Plain Insight Panel. Why do you want to do this test? And so there are certainly personal reasons for doing the Plain Insight Panel. You may just be curious. You might want to know what you carry. What's in your family? Does Grandpa Martin carry the mutation for MSUD, or did it come from the Oberholzer side? You may want to know about actionable health information. You might want to know whether you might be predisposed to high cholesterol levels. So that's also on the Plain Insight Panel. But there are certainly other reasons to do it that are more community-based, public health-based. Among those is pre-symptomatic detection for newborn babies. We want to find these babies before they get sick. And knowing the parents are carriers gives us a little bit of information, gives us a head start. And this can help prevent untimely death and disability. So this is sort of a public health and a community benefit of the Plain Insight Panel. But there's another reason to do it, and that is to reduce healthcare costs. So reduce costs in the community for taking care of children who have special needs. So, to give you an example of this, how does the Plain Insight panel possibly save the community money? Well, we went and looked at a 10-year period, and we looked at all the children that were born with maple syrup urine disease from 2008 and 2018. There were 25 children born in the Mennonite community with maple syrup urine disease. 18 of these children, 2/3 of them, had parents who knew they were carriers. When the baby was born, they sent that cord blood to the clinic. The baby got a diagnosis on the first day of life, and none of those 18 children ended up in the hospital because of MSUD. All of those children did well in the newborn period and were started on therapy immediately. Now, what about the other 7 MSUD children? Well, those 7 were born to parents who didn't know they were carriers. So these children looked normal at birth, but got into trouble very quickly. These 7 children all ended up in the hospital, in the neonatal intensive care unit, a very expensive place to be when you are a newborn. On average, these children got a diagnosis on the 5th or 6th day of life, far too late for MSUD. They averaged over 7 days in the hospital, and those 7 patients all had bills of over $100,000 each. The total bill for those 7 children was well over $1 million. All because we didn't know that the parents were carriers. So there are 2 lessons here. Late diagnoses for a disease like maple syrup urine disease are costly. And they risk death and disability. And number 2, early diagnoses prevent newborn hospitalizations. And they potentially could save the community millions of dollars. And this is just one disease. Maple syrup urine disease is one of many that are found in your community. If we add up the savings for all of these diseases, we could be talking about tens of millions of dollars that is saved in healthcare costs. It's money that remains in the community, in your pockets. Now, it may seem counterintuitive for me to argue that you should spend $150 to get a test so you can save money, but we all know sometimes you have to save money or spend money to save money, and that's a lesson here. So I urge you to go and order your PIP if you haven't already done it, particularly for the young folks here. I know they're hanging in the back somewhere, but for the young folks, they really should be thinking about getting the PIP run on themselves and their spouse when the time comes. And FYI, we have a booth here, so you have no excuse. We've made it as easy as we can for you to get a PIP today. You can go back to the booth, talk to Carla Brigatti. Your blood can be drawn right here today. We can fill out the paperwork, and we can get you your results within 4 to 6 weeks. Finally, I just want to make 3 quick comments about the Plain Insight panel. First, the cost of the panel to you is $150. To the clinic, we spend $550 per sample to run that test. So the clinic subsidizes that test to the order of $400 a person. That's why you're all here today. We need your support to continue to offer this program and do this testing in your community. I also want to remind you, I get this comment quite frequently, well, I don't have any close relatives with MSUD. Why do I need to do the PIP? Well, assessing risk based on how closely you're related to someone with MSUD is not a safe bet. Many, if not most MSUD couples do not actually have a close relative with MSUD. And that's the problem. I can't look at you and tell whether you're a carrier or not. We need to do the test. And finally, if you were, when you got your number, you may have noticed these little 3x5 cards sitting up on the counter. If you didn't, I will tell you what it's all about. So these little cards are for donations, and you can top off your auction bill with a little extra donation. So think of it as a donation for maybe a young couple in the back that needs to have a PIP. Why don't you give $400 to fund that PIP for one of the young couples in the area? So please consider that when you settle your auction bill. Take a look at the card and spend a little money. Remember, it's an investment. Spend a little money to get a big return. Thank you, and I'll let you get back to the fun. There's lots of food here. We don't want to take any of it home, so eat up. Don't worry about your waistline. That's something you can deal with next week. Enjoy your day. Enjoy the fellowship with everyone else, and thank you for coming out and supporting the clinic.